During this pandemic, so many of our friends and neighbors and family have needed medical care. And for some, with that comes the burdens of medical debt and potential to be sued and pulled even deeper into poverty here in Maryland. Now, a new bill would protect patients from that. WMER2 News' Abby Isaacs explains.
The Medical Debt Protection Act still allows hospitals to collect the money they're owed, but it protects patients from getting sued or losing their house or wages for seeking medical care.
No family deserves to go through what we did, to lose their home because of medical debt.
For Nick Mostris and his Harford County family, it started back in the 1990s. His dad was diagnosed with a rare and chronic disease, and he got treatment for 15 years before he died. But still, the bills rolled in.
I saw the shock and the stress of the bills take over my mother's every waking moment.
A lien was ultimately placed on her home. After she died, Mostris was forced to sell it.
The original bill was just $6,000. Now it had become over $26,000 in interest, late fees, court fees, and attorney fees. Why is it right for hospitals to profit off of sick and dying people?
It's one story of many. The Maryland Consumer Rights Coalition says between 2008 and 2018, Maryland hospitals filed over 140,000 lawsuits against former patients to collect medical debt, often targeting communities of color that are now adversely affected by COVID-19. And a nurse says the fear is keeping some from seeking medical care.
The COVID-19 pandemic, it's really driven home the understanding that avoiding necessary care, it puts lives at risk and it can lead to the spread of more disease.
That's why they're pushing for the passage of the Medical Debt Protection Act. It allows hospitals to continue debt collection, but puts protections in place, prohibiting lawsuits for all medical debts of $1,000 or less, and stopping property liens to satisfy medical debt judgments.
It says guardrails so that people are not dragged into court for $250, having to miss work. And have all of that stress. It says guardrails so people have a shot at paying bills back through a reasonable payment plan before things are turned over to debt collectors.
The Maryland Department of Legislative Services says restricting actions hospitals can take to recover medical debt will increase uncompensated care, leading to an unknown increase in expenses for health insurers, Medicaid, and self-pay patients. The Maryland Hospital Association president says they have some concerns about the bill, but they're open to suggestions to improve how hospitals administer the payment process. Now, there was a House committee hearing on the bill today, and it's being heard by a Senate committee next week. For WMAR2 News, I'm Abby Isaacs.